This is my 21.4 ergogenic aids assignment. So, ergogenic aids are any external influence that can enhance athletic performance or facilitate physical exercise. So, you can have mechanical aids, which could be an endless pool, nutritional aids, which could be beetroot juice, which contains nitric oxide in, pharmacological aids, which could be anabolic steroids, physiological aids, which could be blood doping, and psychological aids, you could use positive self-talk. So these aids can give athletes an advantage over the competitors. However, certain ergogenic aids are illegal, and agencies have been set up in order to stop the use of them. So you've got WADA, which is the anti-doping agency, World Anti-Doping Agency, and they promote, coordinate, and monitor at an international level the fight against doping in sports in all forms. And UCAD, which is UK Anti-Doping, who provide education in aim of prevention, governance, and they do testing programs too. So doping in sport can also be reported to them. But you've got some agencies which are actually rife with loads of illegal ergogenic aid enhancements. So, for instance, you've got the International Association of Athletics Federation, which is the IAAF, and they're currently facing a massive blood doping scandal. So the use of drugs within sport is really heavily criticised, and this has led to lots of repercussions for the IAAF. And so Adidas, their biggest sponsor, has actually terminated their contract. So psychological aids, which is techniques that support the athlete's mental state, which could be music. So in general, psychological aids are really safe and effective. There are a range of these that can be achieved with correct training. So you could do hypnosis, but this isn't really available to everyone, and some people might feel quite uncomfortable projecting themselves to it. So there's a more readily available, music is more readily available. So you can have soothing music which will calm pre-game jitters, that can help with anxiety prior to competition, so that would be very good for archery. And energetic music could pump you up before an event, because the core brain activity is increased, which increases arousal, which increases motivation, so that might help you with your assertiveness and confidence before a rugby match. But drawbacks: music can't really be used inter-event, so a football player won't be able to listen to music before they take a penalty shot. It's just not going to happen. So becoming reliant on music to create the correct atmosphere can be counterproductive, because an athlete needs to be versatile and ready to perform in all atmospheres, really. Physiological aids, so you can have legal and illegal ones. Legal can be natural substances like herbal tea or acupuncture, and these are widely available to the entire population. So some athletes can take these as alternative drug supplementation, basically, and most of them are safe and effective. But also there are illegal ones which are used regularly in sport. So blood doping is such a cause for concern within elite cycling. It involves putting extra blood into the body, which increases the level of hemoglobin. It provides an increased oxygen carrying. So this means it's prevalent in endurance aerobic activities. So blood doping can be done via blood transfusions, but the increased amount of blood within the body can actually be quite harmful. The blood is concentrated, so this means when it's put back in the body, it can sludge, which could actually result in a stroke or a heart attack. And other side effects could include kidney damage, and you've also got the risk of HIV if you're using someone else's blood. So between 1987 and 1990, 18 cyclists died suddenly in their sleep, which is due to this really. And blood doping within sport is now illegal, and tests can be done to identify those that do blood dope. So for instance, when the blood is taken from the body, it starts to age at an accelerated rate. So via blood test, you might actually be able to tell. And in addition, you've got normal red blood cell count, which should be around 45%. If it surpasses 49%, the athlete will be suspected of blood doping, and they will face the relevant consequences. But it can still be possible to cheat by diluting the concentration with saline, or making sure that it only reaches to 49%. Other tests can be done which could actually detect small amounts of plastic within the blood. So it's really a little war between the dopers and the agencies. So pharmacological aids, you've got legal ones, which are caffeine, illegal beta blockers, and these are chemicals that are used to enhance performance. So this includes legal and illegal performance enhancing drugs, as I just said, and they've been used by sports competitors for such a long time, and they can actually be really effective. But they should be used with caution, because even the legal ones can cause quite unpleasant side effects. So caffeine stimulates the central nervous system, and it can help in endurance events, which is really advantageous to those athletes. But it doesn't actually seem to benefit short-term high-intensity exercise, and too much caffeine can actually induce a heart attack, because caffeine elevates the heart rate, and so does physical activity. So that's quite problematic. And also, it can have quite addictive withdrawal symptoms, which can make you quite irritable, and it can give you bad headaches. So you've got to watch that one. And illegal beta blockers, right, so they're illegal in certain sports, but not others. So they're illegal in archery, where concentration and precision is really needed. They stop the heart rate from elevating, and therefore they reduce the risk of anxiousness, which can affect performance. It does this by preventing the adrenaline from attaching to the receptors of the heart cells. And side effects include dizziness, tiredness, blurred vision, slow heartbeat, diarrhea, nausea, and there's also less common symptoms, which can be insomnia, loss of libido, depression, and men can actually become impotent, so that's not good. Nutritional aids are supplements that enhance performance, so this could be protein shakes. They're used to speed up recovery. It does this because there's amino acid in them, which helps repair the muscle tissue, which means that the athlete can recover quickly so the recovery period needed would be shortened, which means that they can repeat their training at a higher frequency and a longer duration, really, making them become better and bigger. But side effects. So these protein shakes, or containers that you just buy in the shop, they're unregulated, so they contain all kinds of chemicals which can affect growth. They can also give you nausea, cramps, headaches. If you're not doing enough exercise either, you'll gain fat. So also, because I said they were unregulated, they contain some banned substances, which aren't always, well, obviously they're not mentioned on the ingredients list. So if an athlete takes this one kind and they're tested, they can be accused of cheating even if they're doing it unknowingly. So guidelines, you need a gram of protein per pound of body weight to gain muscle. You can take more than this recommendation, but it does put pressure on the kidneys. So if you weighed 100 pounds, you would probably need 100 grams of protein to gain more muscle, but if you had more, you're fine. If you had 500 grams, that would be very bad. Okay. Mechanical aids. So these are designed to help the athletes improve, obviously, and they include lots of different things. So they could be specially designed clothing with like enhanced forms of sports equipment, anything really that comes into contact with the athlete, like physical devices, and it's just a physical object which affects performance. That really is what a mechanical aid is. So they're safe and they are quite a good ergogenic aid. They can help more than drugs because there's not really side effects which can have an impact on your health. So in cricket, athletes might use a bowling machine, and this mechanical aid allows them to practice their batting, which really allows them to improve the techniques for a variety of shots. This is because the bowling machines are really precise, so they can be put to any direction, precise in the direction that the ball's released, and the speed can be changed as well, so it's quite advantageous because you can practice whenever you really want to and you don't need anyone else to help you. It's easy to set up, and you can do it whenever, so you can do it lots and get a lot better. Thank you.